Hi, it's Hanna, Sam, and Natalie. We did our project on the endocrine system, specifically focusing on Addison's disease. The endocrine system regulates metabolism, growth and development, tissue function, sexual function, reproduction, sleep, and mood, through a collection of glands that produce hormones. Addison's disease affects the adrenal glands, which are located directly above the kidneys. The adrenal glands secrete the hormones cortisol and aldosterone. Addison's disease causes these glands to produce too little cortisol and often too little aldosterone. Cortisol is a hormone which helps control blood sugar levels, regulate metabolism, help reduce inflammation, and assist with memory formulation. It has a controlling effect on salt and water balance and helps control blood pressure. Aldosterone is a hormone which directly affects the heart and blood vessels. The hormone acts mainly in the functional unit of the kidneys to aid in the conservation of sodium, secretion of potassium, water retention, and the stabilization of blood pressure. There are two causes of Addison's disease: primary adrenal insufficiency and secondary adrenal insufficiency. During primary adrenal insufficiency, the destruction of the adrenal cortex results in the underproduction of cortisol. Here is the normal signaling transduction pathway. First, the hypothalamus releases hormones to the pituitary gland. Next, the pituitary gland then produces many hormones, including ACTH, or adrenocorticotropin. Finally, an ACTH receptor on the plasma membrane of the adrenal cortex receives the ACTH in order to produce cortisol. In secondary adrenal insufficiency, problems in the pituitary glands prevent the production of the ACTH hormone. During secondary adrenal insufficiency, there is little ACTH for the ACTH receptors to receive, resulting in an inadequate amount of cortisol produced. When the body is under stress, for example it's fighting an infection, this deficiency of cortisol can result in a life-threatening Addisonian crisis, also known as an acute adrenal crisis, which is characterized by low blood pressure. During this crisis, people are subject to profound fatigue, dehydration, vascular collapse, renal shutdown, a decrease in sodium concentration, and an increase in potassium. Addison's disease occurs in both sexes, in all age groups, and can be life-threatening. Symptoms include skin hyperpigmentation and vitiligo, weight loss, weakness, hypoglycemia, postural hypotension, and gastrointestinal disturbances such as vomiting, nausea, and abdominal pain. Treatment of Addison's disease consists of hormone replacement therapy to correct the levels of the steroid hormones not produced by the adrenal glands. Some options for treatment include oral corticosteroids such as hydrocortisone, prednisone, and methylprednisolone to replace cortisol.